This podcast is a production of WCWP, LIU Public Radio. Check out our lineup of original programs, listen live, or support by visiting WCWP.org.
The following is a presentation of Project Independence and WCWP. Project Independence is the Aging in Place initiative of the town of North Hempstead. We provide programs and services designed to assist and support the older town residents who wish to remain in their homes as they age. If we don't currently provide a service, we will try and connect you to that service. Call 311 or 869-6311 to get more information or receive services.
Welcome to Project Independence and You.
Welcome to Senior Talk Radio here on 88.1 FM and WCWP.org. This is Project Independence and You. I'm your host, John Ryan, and my co-host today is Otto Lohse. Good morning, Otto.
Good morning, John.
And we have two special guests today, and we were just talking a little bit before we came on the air here. We have Lohse Stern, and Lohse is an Assistant Vice President of Senior and Adult Services at Family and Children's Association. And we have Sarah Samson with us. And Sarah is the Public Service Coordinator and Sexual Violence Prevention program for the Safe Center. And both these organizations, the Safe Center and Families and Children's Association, to have both you guys on at the same time is just an honor, because the amount of work that you've done throughout COVID, but even prior to it, everybody knows who you are. So ladies, I want to welcome you both. And actually, for no specific reason, I'm going to start with Sarah. And we're going to be talking in some elder abuse. And I know actually Otto has the program coming up in a week. And I do a program called Project Safe, which is Seniors Against Financial Exploitation, which is financial abuse. But we're going to be covering all different kinds of abuse today. And the one I want to start with, which I think brings the Safe Center into it, is physical abuse. Mm-hmm. And especially in COVID, where, and I know I'm saying this is not factual because men get abused too, but it's a greater percentage of women, and they are stuck in the house, and there's nobody even to witness what's going on because they're really prisoners. Yeah. What do you find going on there, Sarah?
So across the board, there definitely has been an uptick in domestic violence cases. We definitely find that as people are isolated in their homes, they're with their abuser more often than the opportunities that they would get to even go to the grocery store or, down to the park, all those things that we typically would see people do to, either get away from their abuser or have an opportunity to seek help is very, very limited. So definitely being in the home with their abuser more is a huge problem. So there definitely has been an increase in frequency of abuse. When we talk about cases, is there an uptick in cases? I mean, the abuse was happening prior. I think it's just more of we're seeing it more frequently. So again, those when you're at work, you're away from your abuser, so you're not having to face them as often. So I think that being in the home, being in lockdown, has been very detrimental as far as physical abuse, for sure.
And just to follow up on that, and this is, some people have these answers and know all about it, but we'd like to take this program from we're introducing everybody to it for the very first time. Mm-hmm. Why, in your estimation, and I'm going to speak from a woman's perspective, are women prone to be abused and forgive me if I'm not being socially correct, but accepting of it? That's the part that bothers me. Like, there's places like your center, like Families and Children, you can make a phone call. Yeah. I know it's hard. People don't want to change, but whatever.
I think the danger of it and the fear is a huge factor. So it's not necessarily someone accepting that behavior, but typically, if it's a family dynamic, there's children involved, so you fear for your children. Even in elder abuse, we see very frequently it's their caregiver or their family member. So who wants to get their family member in trouble? I think the dynamic is so complicated, and that's why it makes leaving so complicated, because it's typically, for the most part, it's someone that you love, even though they're abusive. So that's the really difficult part about domestic violence and understanding it. And last month was Domestic Violence Awareness Month, and we did a lot of reflection on how COVID has really impacted people and how it needs to be treated as a systemic problem. So just like we treat COVID as a public health crisis, looking at things like elder abuse, domestic violence, sexual violence as a public health crisis really changes your perspective and your lens. So I'm a public health coordinator and the EMDT coordinator, but I do a lot of preventative work. So the sexual violence prevention is focused on a public health model, just like we look at COVID. So you look at it like a disease where you want to treat it before someone else gets sick. So that kind of shifting that thinking, yes, we want direct services. It's like essential, but also incorporating preventative services, especially for domestic violence.
Okay, now we're going to go over to Lisa and ask her for the same input. Actually, just something has come to mind as I'm going to Lisa. I don't know. I know you guys are relatively young, but Otto, I'm sure, has seen Carousel, the musical.
Yes.
And it's the Partridge Family mother who is the woman on Carousel. And one of the lines in Carousel, and I haven't seen Carousel in years, was when she was, I think, talking to her daughter. And the guy she loved had died. He was a drunk and everything else. And her response to the daughter was something is, love is when he hits you and you don't feel it. And it was like, oh my God, where are we? You wouldn't, you couldn't make a movie and put that kind of a line in it today. But back then they were saying, guess what? You take the hit. If you love him, you take a hit, and you don't take a hit. Lisa, we're going to you now.
Well, I think with seniors, 90% of abuse is happening from someone the person knows. So It's someone that's trusted. A lot of times it's someone that is a child living home, and maybe they have a drug problem or a gambling problem, financial issues. They're not working. Especially with COVID, this has heightened the issues because they're not able to get to their support system that they used to have if they were in treatment, or if they had support groups or counseling. That has been a challenge in COVID, so the problems have escalated. I also think with seniors, there's a point where, family dynamics that have not been, have been going on for a very long time that are dysfunctional. When you're older, a little shove can break your bone. It's a different, it escalates. So a senior might have been okay dealing it with in the past, but now they can't. So I think there's, just a raising of awareness for seniors of what do we mean when we say elder abuse? It can be a family squabble that goes too far. It could be a drinking habit that's out of control and the person's isolating the senior. Also when there are perpetrators, the senior is isolated from other people, so they don't have the option to reach out to someone, or they're afraid they're going to be put in a nursing home. They threaten pets. They're going to harm their pet. I mean, there are so many things that frighten a senior. They're also worried if they fall victim to a financial exploitation that someone's going to question their ability to live by themselves. So they feel threatened by that. So it's a silent, it's a silent process. It's something that's very underreported, elder abuse.
From an elder abuse perspective, you've covered different things. There's physical, there's financial, not so much sexual, there's neglect, but would I be right? Say it again. What did you say?
There's sexual too sometimes. I think also there's ageism. So we only look for certain things when we have this vision of what an older person, might experience. Or if someone has dementia, you dismiss what they're telling you. So, there's a lot of ageism.
Okay, thank you for correcting that. But would it be safe to say that the biggest thing from a senior's perspective is psychological? Just a fear factor, like you said, money. But now I'm afraid they're going to move me. So that's a lot of these things are in the mind. They're not making them up. They're legitimate levels of abuse. But it seems like you're playing on the poor senior's mind. Yeah,
I think as you get older, you get more vulnerable and you're more isolated, and your your support circles get smaller because you lose loved ones, you lose family members, you might not be living near your child, you know. But it's also, we were talking about before, it's the only crime where the person might love the perpetrator more than they love themselves, and they want to protect them. Especially during COVID, people were less likely maybe to evict their loved one from their family home because they didn't want them in a jail or in a hospital or homeless during COVID. So that kept everybody very silent about it.
How do you, I'm sorry,
Right,
but how do you,
no, you go.
Sarah, you indicated big uptick in caseload now. How do you get the information that there's abuse going on? You know, I can understand the person who's being abused worrying about the repercussions. You know, what happens to me, what happens to the people who are abusing me, and the whole routine. So it seems to me that there are probably a lot of other people who are the ones who actually report this to you. I don't know. I'm not an expert on this topic, but you know, how do people get to you to let you know that there's a problem?
So the uptake really comes from the anonymous hotline reporting. I know for the DA, we had a conversation with Arlene where they did see for elder abuse an uptick in cases through the DA. So that's like a little. The reporting is different. So then there's like reporting where you go to the police, and then there's reporting where we get hotline calls into the safe center. So actually the hotline calls were a little lower than normal because I don't think people have the ability to make those calls. So it depends on how the police are responding. So if it's a call that's coming to Nassau County PD, I'm not sure what the numbers are on that. I'm assuming it's higher than normal just from the news, you know, just watching the news. There's been a lot, actually, just today in Suffolk, I read the news that there was a DV case that ended in a murder-suicide. So we've been seeing a lot of that going on. So we would have to look at the police reporting, but I know as far as elder abuse, the DA definitely has seen an uptick in their cases. I think it was from like April, May, June, they were very high. So that comes from, you know, people finding the time to either make the report or, you know, neighbors get concerned or there's an injury. So I think that there's a couple of different things that could be happening, but I'm not personally sure exactly. And that's the thing with domestic violence and elder abuse. There's like not just one thing. It's like a lot of things. Every situation is so different. So we were starting to look at things case by case with care.
I'm going to have to jump in here. We're going to have to take our first break, believe it or not. You're listening to Senior Talk Radio here on 88.1 FM and WCWP.org. We'll be right back.
Project Independence is the Aging in Place initiative of the town of North Hempstead. One of the many services we offer is help at home with minor home maintenance. Call 311 or 869-6311 to get more information or receive services.
Welcome back to Senior Talk Radio here on 88.1 FM and WCWP.org. This is Project Independence and You. I'm your host, John Ryan. My co-host today is Otto Lohse.
Very tough subject, John.
I know it's a rough one because we're here with both Lisa Stern, who is from Families and Children's Association, and Sarah Samson, who is from the Safe Center. And we're talking about elder abuse, and we're talking of all the different kinds of abuse there are. And at the break, I just mentioned that Nassau County Police Commissioner Patrick Ryder was on several months back, but basically said through Corona, the COVID pandemic, the robberies, everything was down basically in Nassau County, except for abuse cases. That was on the rise. And across the board, sexual, financial, everything. And it's a terrible, terrible thing that, you know, and we even had Madeline Singus on, and she was talking about, you know, it's hard to get the word out that to be an abuser. I'm president of the Great Neck Senior Center, Social Center it's called now. And I used to tell people, you know, if something's happening, when you get together for lunch, you have an outlet to tell the ladies, and the lady might tell somebody else. And I know a situation when one of the ladies went home and told her son what was told, and the son made a call and blah, 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 blah. And the end result was the situation got straightened out. Today, there's no place, as we've been talking with Sarah and Lisa, for these people to go. You're stuck in the house. You're afraid to make a phone call because if you have a real crazy husband, he's probably tracking your phone calls. So I it's just, I don't know what the answer is. It's heartbreaking that this exists. And it's so wonderful that there's organizations that also exist to help out. But at the end of the day, and I'm going to go to Lisa to start this second piece. Where is it that you find the most benefit coming at us for senior? I'm trying to say it's.
Yeah, I mean, for us, I like to call us a one-stop shop for seniors because we help with health insurance, we help with home energy assistance, we help with case management and in-home assistance. We have our Safe Observant Senior Program, which focuses on elder abuse. We have a linkage project that reaches out to seniors who have mental health or substance abuse issues. So it doesn't matter where you enter FCA, you're going to get to the program that's best for you. Plus, during COVID, we did a lot of outreach. We addressed food insecurity. We had everybody making a lot of calls out to seniors that are on our rosters. There were a lot of opportunities. We did a lot of Zoom presentations on financial exploitation, through the libraries and through the senior centers. So I feel like we were out in the community. We get a lot of referrals from the district attorney's office. And what our SOS program does is we act as a liaison with the district attorney's office, and we provide support, counseling. We connect with resources. We help with financial stuff. We help with food insecurity. We even help the perpetrator sometimes, because if we can get them help, sometimes seniors don't want to prosecute. We try to convince them to help get their loved one help. So, we connect them with the right program for that as well. We don't tell them what to do because a lot of times they don't want to prosecute or they're afraid for their loved one. So we try to work with them to look at their options and really support them. But because we have so many programs, we have a bill payer program that helps seniors pay bills. And even during COVID, they were picking up people's bills from their houses in paper bags and doing it in the car and bringing it back to them. And a lot of times it's our bill payer program that picks up a financial issue with a client. Like all of a sudden they can't pay their bills. So they'll reach out to our SOS program, and our amazing team, who's very compassionate and supportive, guides them through this whole process that can be really scary. Pre-COVID, we would go with them to a police report. We would go with them to court. A lot of times family members aren't allowed in court with the client, but our team can go in with them. It's a very scary thing to go to court. So we really try to provide that support. And because we are connected in so many ways with seniors, it's thousands of applications for HICAP or for HEAP that we do a year. So we can send out flyers on our other programs so people know where to get help. So you can get help at FCA. And if we don't do it, we're really connected to other resources in the community. And, we connect you with those resources. We have this wonderful EMDT, which Sarah runs, and we get together once a month and present cases. And those are people who are from hospitals, from the police department, from adult protective services, which we work with a lot, from the Safe Center, all different representatives on this EMDT. And that's how
what does EMDT mean? What's EMDT?
So the EMDT is an enhanced multidisciplinary team. So kind of like, how they have like a child abuse MDT where it's a group of people gets together and assesses cases. This is for ages 60 and up. We take cases that have either the enhanced part is the financial part. So we know financial abuse is very common in elder abuse. So we look at financial abuse cases, neglect, abuse, sexual abuse, anything that may be happening, and we triage these cases. Anybody can make a referral, so it can come from someone from our team, another agency, or a self-referral. It could be a senior reporting abuse that's happening. So we get together and we look at these cases, and it's a way for us to really triage them very quickly. get the services that are needed. So maybe FCA is doing something, APS is doing something else. We have, a bank on our team, Teachers Federal Credit Union. They might look into some financial stuff. We have an agency upstate that looks at does forensic accounting. So there's a lot of different resources to figure out what exactly is going on, how to best assist the senior, and make sure that we make it a priority that we're doing what they want, what they would like to see done, while keeping in mind what's best and what's, safest, keeping their self-determination, making sure that everything is surrounded around that senior in the best care possible, so that we can get the cases pushed through and taken care of. And it's a really great team. We have like 20 to 25 people that come every month. We meet for 2 hours and we look at the most complex cases. I also do, outside of the EMDT, I'll take case consults. So if it's like a case that they're just like stuck and they can't find the right referral, I try to find one for them. I talk to people on the team, get the best services for that senior. And then, we won't bring it to the EMDT, but they're still getting services. So it's been I started in February, and this team is just so amazing. We all learn so much from each other. It really is just incredible, the amount of services and the knowledge that is out there. Like we're talking about, the DA's office has just been so wonderful. They're like a really instrumental piece. APS, FCA, the hospitals, just all collaboratively working together, and for the whole family. And that's something that struck me doing this work, because I do other, work with younger generations. It's interesting to see that with seniors, we're really looking at not only care for the senior, but for the whole family unit, because it is typically an adult child or a spouse. So we're trying to get them services too. So it's the one situation where we're like really looking at not only the victim, but how can we help the perpetrator so that the victim can live out their life, hopefully in the end, with a healthy relationship with that loved one, because it is so difficult. Or how do we get that loved one removed from the home, and possibly they might just want them, they're just done. So they want their family member to get help, but they don't want them to live with them anymore. They don't want to necessarily be around them, but they do care about them and want them to get help. So it's a very interesting dynamic.
Yeah. It takes a village. It does. It takes a village. It's a real joint effort. Also, we're very connected with the Office for Aging. They fund our ISAP program, which is Case Management and In-Home Assistance. We work with New York Connects also, so they get calls from the community on where to get help. And often we'll get referrals through that way too.
Otto, did you want to say something?
Yeah, to me, it seems like one of the hardest parts of this thing is to get abuse out from under the radar, if you will, like you used the word before, Sarah. How do you get, like, how many people are being abused that people have absolutely no idea of? Of all the abuse cases, I have no idea, but let's say 10% are identified. That means there's like 90% of these things that are going on where the people are, like I like to put it, me, and a lot of other people, we're fat, dumb, and happy sitting in our recliner, and we have no idea that this type of thing is going on. How does it get out from under the radar so people like yourselves and organizations like you can help both sides? To me, that's the hard part.
Earlier this year, we hosted a conference, and it was for seniors and for professionals. And we did a whole panel on education, educating people on elder abuse. And Sarah had organized one prior to that as well, a few months before. So we're really trying to get the word out that way. We used to do a lot, obviously, before COVID. We would go into the senior centers and we would go out on the road and, do presentations to try to get people. We're also connected with discharge planners from the hospitals, because a lot of times you'll see the victim end up in the hospital. And if there are red flags, we can work, get referrals that way as well.
The question that I have, which I don't remember, honestly, if it was Lisa or Sarah who touched on it. People want to go back to the abuser. They don't want to cut all ties. I'm not confused. I understand human nature is human nature, but is that what you see a lot of? It's not a matter of that I want away from this guy or woman completely. They actually want to be together. You're shaking your head, Lisa.
If it's your child, yeah, you just always hope that they'll get better, and you have a maternal instinct or a paternal instinct. So you don't want to see them fail. You don't, it's just a matter of hopefully we can work with them to help them to help that person,
Okay.
rather than,
Okay.
and sometimes it's not jail time, but it's getting them into a substance abuse program, or it's connecting them, with mental health treatment, or, a lot of times they're off their medication. So if you get back on their medication, they're able to function better. You want to engage the senior in trying to recognize that something has to change.
Right.
Which
Okay.
is sometimes hard when you're in a family pattern that's existed for years and years.
What about husband and wife? Do you find the same thing there?
Sure.
Really? Okay.
Yeah.
To me, I would be looking like if you can get away, start your life over, and find somebody who actually loves you.
Sometimes it's also a financial issue, to separate your incomes, and, you can't afford to stay where you're living. Also, you're vulnerable when you're older, and that person might be a caregiver.
Right. Okay. That's true too. You're forgetting that part, how they have evolved in your life. I want to continue on this, but believe it or not, we've got another break coming up here. So you're listening to Senior Talk Radio here on 88.1 FM and WCWP.org. We'll be right back.
Project Independence is the aging in place initiative of the town of North Hempstead. Some of the many services we offer include nursing and social work services. Call 311 or 869-6311 to get more information or receive services.
Welcome back to Senior Talk Radio here on 88.1 FM and WCWP.org. This is Project Independence and You. I'm your host, John Ryan, and my co-host today is Otto Lohse. And we're having the most phenomenal conversation with Lisa Stern, who is with Family and Children's Association, and Sarah Samson, who is with the Safe Center. And I said it's a wonderful conversation. It's a terrible subject, unfortunately, but it's a subject that has to be discussed and has to be acknowledged. More than just discussing it, we have to bring this to the front of everybody's minds, because there are times when it may be a neighbor or a friend who sees something going on and says, this is kind of weird. And I don't know how they go forward. And actually, that's what I'd like to talk about, actually. If you're a caring neighbor, you're not just going to go and confront the woman who's being abused and say, you're crazy, you got to get out of here. But what does a concerned neighbor, friend, even relative do? If you see your sister is, not happy and being abused, do they should that person intervene on their own, or should they reach out to you people and make a phone call, or should they just, anyway, as you can see, I have no idea what the answer is, so I'm throwing it over.
I think it's important that they reach out to somebody. I mean, if you suspect abuse, you might call Adult Protective Services, but if you're really concerned about their safety. But if you reach out to us, we're gonna kind of reach out to the person. We always need consent from the person, though. They need to consent to work with us. But we can reach out and say that someone was concerned, or sometimes we can offer help in some of our other programming, that we have.
You could actually call somebody. So if I was the one being abused, you could actually call me on my cell and say, it's been brought to my attention, and I can turn around and say, thank you very much, Lisa, I'm fine, and hang up on you. Or you might got me at a good point, and I'll say, what's my next step?
Or we can say, if something changes in the future and you need our assistance, here's our phone number.
Okay.
And we have really trained staff that are gentle when they make that call.
Okay.
Now, are those kinds of calls, like the person who called in, is that anonymous?
Anonymous. Yeah.
Yeah. In other words, their name is not used to say, oh, Jojo told me to call you because he thinks you're being abused.
Right. But if you really suspect exploitation or abuse, you should call Adult Protective Services, and they're not going to disclose who makes that call. But if you're really concerned and you want action, I would call Adult Protective Services.
Yeah, what would that be? Do you have a phone number for that, or?
Sarah, do you know APS?
Yeah, I think I
I
actually.
don't have it off my top of my head.
No, that's fine.
I'll
The
look for
county
it.
number,
Chat.
227, I'm not sure.
Okay.
Mhm.
Now that's important, Otto, because, people want to help. Sometimes an individual who jumps in to help could actually make matters worse. You go over and you ring the doorbell and I confront the person and say, I know you're really being a schmuck and abusing your wife. Well, that's not going to go over big, that poor thing that night.
Can I give our contact information? 'Cause
Absolutely. I want everybody's
sometimes
contact
people
information.
call us just to chat and say, what's the best course of action? Every situation is different.
Okay.
So it's 516-485-3428 for a Safe Observant Senior Program.
And that's through Family and Children's.
Family, FCA, Family and Children's Association.
Right.
And sometimes it's people call and they just want to run something by us and we can tell them their options. Sometimes you have to have patience. It takes time, for someone to come forward or someone to want to take action.
Okay.
And sometimes if they hear a friendly voice and someone who is compassionate, they slowly gain trust, build trust. It's hard for them to trust someone with that information.
No, I'm agreeing with you 100%. And actually, Christina got the other number. I don't know if you got it, Sarah? Also,
I just saw the one that she put in the chat. Yeah.
516-227-8519. So it's 516-227-8519. And either one of those numbers. I mean, the important thing is anybody listening today, and if it's affecting you personally, or if you know somebody, you have to say something, but you have to be gentle. I understand that you can't go in because you'll only make matters worse. You can't confront the abuser because that'll only make it worse. I'm assuming when he goes home that night. And again, I'm saying he, it could be the woman, but I assume most of the time it is the man, unfortunately. And then there's children involved. And unfortunately, they're young children that, and that, goes with them. And I'd like to touch on that right now. The abuse within a house stays with the children for years and years and years. And it even screws up their relationships. Not everybody is going to realize that what my father did was wrong, and I wouldn't do that to a woman. Some think that's the way to act, I think. And so therefore, if your father hit your mother, there's nothing wrong with being abusive to a girlfriend. Let's touch on that one, and we'll start with Sarah.
So that's like a really complicated, family violence is so complicated. But in that dynamic, yeah, definitely it has a huge impact on children. So far as I don't know if anybody's heard of the ACEs study. So the Adverse Childhood Experience Study, where there's a questionnaire, it's about 10 questions, and your score, if it's higher than 4, you're at risk for a lot of things, behavioral, physical. It's trauma, so it changes your brain essentially. So kids are really resilient. So that's the wonderful thing, that if there is violence happening in the home and there is intervention, they will be okay, but we know it's underreported and it's very frequent. It's very prevalent in communities. So that makes it really complicated. But when we're looking at elder abuse, so typically, family abuse, family violence doesn't just happen overnight. It's not like, you're 60 and over and all of a sudden you're experiencing these things. Definitely that happens as, circumstances change with finances, health. But typically when we're talking about family violence, this is something that's been going on since their adult children were children. So it makes it a harder dynamic to look at, because we're looking at a situation that's been brewing for years and really decades. So that makes it really complicated. But I think when we're talking about, preventing that, and we're talking about preventing family violence, there's a lot of things that are being done in communities that I think we need to raise more awareness, about, I think, like at the Safe Center, we do safe dates and focus on healthy relationships. In the education department, they go into the high schools and they talk to kids about what is a healthy relationship? What does that look like? We talk about consent. We talk about boundaries. So there's a lot of education and prevention going on to hopefully stop that violence that happens. But I think, again, like you were talking about, acknowledging it, talking about it, making it more open, not just what happens behind closed doors stays behind closed doors, but being comfortable with going to people and saying, this is happening in my home and I need help. I think that there's a lot of stigma attached to asking for help just in general. But I think if we really root out those problems, then as people age, we're not, that's going to lower the elder abuse that happens. If we have children who become adults and they're abusive towards their parents, that hopefully can stop when we stop it at the root in the beginning.
Right. Actually, Sarah, Lisa told us a little bit about Family and Children's and the various things that they do. And you just give us a little bit of an overview of the Safe Center.
Yeah. So first I'll give you our hotline because that's really important. It's 516-542-0404. And anyone can call, and get advice on a situation that they're experiencing, ask for help. So we're a domestic violence, sexual violence organization. We serve all ages. We are co-located with the Child Advocacy Center and the Special Victims Squad. And we have legal, we have a medical office where a same nurse can come in to do sexual assault examinations. So we are a holistic, we take a holistic approach to treating family violence, sexual violence. We offer counseling services through our rape and sexual assault team. We have the human trafficking department that deals with, youth in our Safe Harbor program up to adult. And then we have our education department as well. That's the department that I'm in, and we do anything from awareness workshops to education workshops. We go into the high schools and do safe dates. I do a nightlife program, so I do sexual violence prevention in nightlife. We have
nightlife.
Yeah, it's pretty cool. We have a wide variety of services that we provide to prevent and treat family violence. And all of our counselors that work with children and our rape sexual assault staff, they're just wonderful. It's a great place. I love it there. And our elder abuse is a couple of people, just really me and Jill, who's our adult advocate, but our other services will incorporate elder abuse cases. So if you are experiencing any type of violence or financial abuse, we will, accept referrals. And in some cases, we might say, you know what, FCA actually can handle this really great. And seems like you have a lot of things that you need addressed, and we will reach out. So that's nice too. We can kind of collaborate with other organizations.
Yeah, we shouldn't forget the magic number 311 also for any, like if somebody's in a situation, you call 311 and they'll filter you to one of your organizations.
Yeah, sure.
I have a scenario. You talked about financial abuse. This is a friend of ours who's not in this state, gave power of attorney to the children and had early signs of dementia. The children immediately proceeded to sell everything she ever owned because they had the power of attorney. So now this person is completely captive and has no control over anything. And those kinds of situations are, to me, that's abuse too. How do you, I guess you have to educate people, as far as like you give a power of attorney, you're giving a power of attorney, and you better be sure who you're giving it to. And, it's, I don't have an answer to that. I'm just pointing out that these are real problems that real people face all the time.
I think it's really important too to educate throughout the lifespan, but definitely seniors, about what power of attorney implies and entails. Because I know from talking to, legal on our EMDT, I'm not an expert in any of, legal stuff. I'm still learning. It's so complicated. But as far as power of attorney, unless there's a real, substantial capacity issue, you do have a say, in what happens in your life still. So I think that power of attorney piece is really, really important in just educating, like, what are your rights? If you do have a power of attorney, as the person that they have that quote unquote power over, what does that entail? What does that look like? What are your rights? So that if they are being exploited, they understand that they still have a voice and they still have a right to say this isn't right.
We're going to come back to that after the break. Believe it or not, we have to break again. You're listening to Senior Talk Radio here on 88.1 FM and WCWP.org. We'll be right back.
Project Independence is the Aging in Place initiative of the town of North Hempstead. Some of the many services we offer include fitness classes, community education, information, and referral. Call 311 or 869-6311 to get more information or receive services.
Welcome back to Senior Talk Radio here on 88.1 FM and WCWP.org. This is Project Independence and You. I'm your host, John Ryan, and my co-host today is Otto Lohse.
Learning a lot about a tough subject, John.
Oh, it's a rough one, but I'm going to give out full titles now. We are with Lisa Stern, and Lisa is an Assistant Vice President of Senior and Adult Services at Family and Children's Association, and Sarah Samson, and Sarah is the Public Health Coordinator and Sexual Violence Prevention Program Coordinator for the Safe Center. And we're having a wonderful conversation, but just before the break, Otto gave a story about somebody who signed over a power of attorney and then wound up having stuff taken from them. And it is a very difficult situation, and people do have to pay attention. And, the Family and Children's Association goes out, the Safe Center goes out, I do programs, but I keep track. And so far, we're in November. Newsday, if you followed Newsday for this year, over $500 million has been taken from people. They've all been convicted. Just last week, there was somebody who had got $30 million. The biggest one was $200 million, which was announced in maybe August or September. There is no recourse for this money. I mean, you'll get some of it back, depending if they bought a fancy car, they're going to sell the car. Lots of it was vacations and wasted money. How many times do you have to read an article in the paper? And then when you get an unsolicited phone call that, you want to make 25% on your money, you say, oh, tell me about it. It doesn't exist. And if it does exist, he's bringing it to his family and close friends because they're private little deals. And that is one of the biggest peeves I have. I don't know what the education has to be to get people to wake up, and going back to, we'll go to Lisa, but one thing, I have 3 different couples over the last 5 years that went to marriage counselors before they got married. And all 3 are divorced. Why would you date somebody, get engaged, and then say, I said, what are you doing? We're going to counseling. I was like, shoot me. Go to counseling. Just tell them goodbye. And they ultimately did, but they got married. Now,
if only it was that simple, John.
Well, it's simple in my life. Go ahead, Lisa.
Well, I know scams are really a big thing, especially during COVID. People are, when you're isolated and you're lonely, that's a big thing. Seniors a lot of times are lonely, and these scammers are really good. They're good at gabbing with you and talking with you and acting like they care about you. I mean, I've had a situation where family has begged the senior not to send money anymore, but they really like the calls, and no matter what the family said, they couldn't stop this senior from sending money. And especially with COVID, the last few months, there's been census scams, there have been stimulus check scams, COVID-19 scams. You really want to not answer your phone if you don't recognize a phone number. You don't want to sign anything unless you understand it or have a trusted person to review it. You want to shred old papers. There's a lot of things people can do to protect themselves. You don't give any personal information out over the phone. My own father fell for something the other day, that seemed so real from a software company. It's just, you got to be savvy and you have to protect yourself. But again, I think it's on the rise because people are lonely, people are isolated, people, are scared.
Well, you're right there. Winter always brings on the worst. You have a senior in the house, it's too cold to come out and they're lonely. And COVID has restricted people. So they're not going out. I mean, we really, 75 and older, you shouldn't, I mean, you can leave the house with caution, but I mean, they are subject to these calls, but it's a shame. It's just like, talk to somebody. I find it very frustrating when you do a program and people can raise their hand and say, well, I gave him $20,000 and I'll never see it again. It's like, you won't, but why'd you do it?
I think that's something we struggle with on the EMDT all the time. People have the right to self-determination. They have the right to make their own decisions. And where do you draw the line where you tell them they don't have that right? Even if, a family member might think that this person shouldn't be sending money here or shouldn't be spending money on that. But, it's a fine line between not respecting someone's right to do what they want with their money or take their rights away.
Okay. I mean, I'll go along with that on a certain perspective, right? Because the senior definitely doesn't want to feel like I have no use at all in life, that I can't even write $50 to my church or my synagogue without my son questioning what I'm doing. I'm agreeing there. But on the bigger scales of things, it's a shame. And they're out there. I mean, that's the other side of it. Go ahead, Otto.
I think that's another subject that probably could take up a whole show, is the transition from being a parent to being the child and in between, that whole area. And the difference of perspective, I think, is that the senior, which I'm a senior, proudly, and you don't want to give up control. That's part of life. You want to control your own life, your own destiny, and whatever. And then your children start to fear for your safety and your security. So there's a fine line, I think, between those two, which can get very fine or very broad. Maybe legitimately the senior does have a big problem and can't walk without falling down or whatever, shouldn't be driving a car, shouldn't be making any financial decisions. And as a senior, I'm not there, fortunately, but I could visualize the difficulty. I'm one who likes to do what I have to do. And all of a sudden, somebody says to me, you can't do that anymore, Otto. I'm going to take care of everything for you. Okay.
I will say that if you feel you've been a victim of a scam, our Amanda Crystal, who works with our financial exploitation program, will reach out to a bank. She'll go with you to file a police report. There's support, and she'll try to get you restitution for what you've lost. You're right that it's difficult to get restitution sometimes, but she will work with the banks, the credit card companies, whatever needs to happen, and she'll guide them through the process and provide support for them. It doesn't feel good to be a victim either, so that you really want to offer counseling and support to the victim.
Doing this show over the last number of years, there is so much help out there for people. If they, people just have to get themselves a little educated in terms of what's out there and take advantage of it. Like a lot of people in my world, this image about charity, this is all looked upon as charity. I don't need charity, which is a nonsense, really. Everybody needs help somewhere along the line, or you don't know enough about a subject. You need people who do know about it to help you. And I encourage seniors to, if you have problems of any kind, look for help. Don't be like Daniel Boone or whatever out in the woods taking care of everything yourself. It doesn't work like that. It shouldn't work like that. Let's put it that way. And the more you give up a little bit, the longer you're going to be able to maintain some semblance of control over your life. It's complicated.
That's very true. I'm agreeing with you, Otto. The other thing too, which, I have a master's in economics and finance, undergraduate, whatever, but I also have a master's in gerontology and thanatology, which is the study of death. And one of the biggest things that I'll always remember is assumptive reality, which was a phrase that I learned, and it kills a senior, because when you come into your house, you assume when you open the door, you're going to go in, the dog's going to be there, the lamp is going to be there, whatever. The day you come in, the dog is gone, the lamp is on the floor, the chair's a table, everything's upside down. they've taken the assumption that everything's going to be okay away from you. And that reality, every time you go to open that door, it's fear-based now. So now you have a 90-year-old woman that says, am I opening my door to see my lamp and my table and everything the way I left it? Or am I going to open my door to a nightmare? And that's the counseling. That takes a long time to overcome. When you've been abused, when you take trust away, specifically from a senior, and the stuff like Otto always talks about, you're not going to trust very quickly again. And especially if you have, and thank God the FCA has a place to go, and they'll try to get some of the money back. Because not only are you not trusting, you got to pay your bills. And you want to buy a Christmas present for Susie or whoever it's going to be in your life. Well, now you don't have the extra money. So it just keeps slapping you in the face that you were abused. And it's a shame, because the person who abused you has gone on, bought a fancy coat or whatever he did with the money he stole from you. And if he hasn't gotten caught, he's lucky. And you live it every day of your life. It looks like you're going to say something.
There's another dimension to this whole thing, that, in my opinion, through personal experience that has developed because of COVID. We haven't used nursing homes or assisted living at this point as a comment, but I know of people who are in nursing homes and they cannot be visited by their family. And we know from past experience with other family situations that it's not always peaches and cream. Within those complexes, there are lots of good situations, but then now and then there's a bad one. And that's very difficult now to identify, because you can't even go in to the nursing home. You look through a plastic window and that's it. Is that an area that your organizations get involved with?
Yeah, so FCA has an ombud service program, and it's a volunteer-run program, but obviously with COVID, it's been a little more challenging. But if you have a complaint or need help in a nursing home, you can call FCA, and we can, have our ombud service program look into it. They have been advocating all through COVID for seniors, for families, reaching out to the executive directors, and there's resident councils that we're part of within the facilities. So there is help for anyone in a nursing home or assisted living or adult home in Nassau County. You would call FCA.
Okay, that's important, because
it's been horrific for seniors in nursing homes, just heartbreaking.
Yeah, and especially considering that they can't reach out, they can't see their families, and everybody knows the story of somebody who died over the last couple of months with nobody by their side, maybe a phone call, knowing it's within hours the person's going to be dead. Ladies, being Lisa and Sarah, I want to thank you both so much. We're going to have you back again, because this is such an important topic. And the more you talk about it, that's the only thing we can hope for. The more we talk about it, whether it's financial abuse, sexual abuse, psychological abuse, it has to be brought to the front of everybody's mind in order for it to stop. And it's not going to stop until that happens. You've been listening to Senior Talk Radio here on 88.1 FM and WCWP.org. We'll be right back.
Like what you hear? Here's how you can let us know. Give us a call at 516-299-2626 or email us at info@wcwp.org. Like us at facebook.com/mywcwp and leave a comment, or tweet us at mywcwp. We welcome all kinds of feedback. To directly support the podcast you just enjoyed, leave a review on Apple Podcasts. And if you'd like to give back, visit wcwp.org and click the support tab. Thanks for listening from your friends at WCWP.